You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's Zone. Today we're doing a deep dive on folate, also known as vitamin B9, and sometimes referred to as folic acid. Now, to clarify, folic acid is a synthetic version of folate, and I don't recommend it. Now, there's another type of synthetic version that's commonly used. It's called folinic acid. Both of these forms, again, synthetic. Where do we find them? Predominantly, we find them in cheap supplements, and we find them in fortified foods. Unfortunately, in its grand wisdom, the U.S. government has decided to add this to, or to use this to fortify processed foods that aren't good for people. And so they add a synthetic vitamin that's also really not good, and there are problems with it to those fortified foods in an attempt to make them more nutritious. So if you've ever looked at the package of a box of bread or crackers or other types of grain-based, especially foods like pastas, etc., you're always going to see folic acid listed in the ingredients because it's illegal to sell these processed foods if they don't fortify them with folic acid. Now, a lot of doctors try to use those terms synergistically or interchangeably, but folic acid is not the same thing as folate, and we're going to talk about why here in just a minute. Now, what are the key roles of folate? A lot of this is heavy. We're going to get into kind of simplifying it, but one of the major roles of folate is in the ability to synthesize DNA and protein. So this is important because this is necessary for growth, especially with pregnant women, children, but also it's important for maintenance and repair of the body, right? If you can't synthesize protein and DNA effectively, how are you going to repair damaged tissues and damaged cells? So very important in that regard. We also know that folate helps to repair DNA. It helps with a process called methylation, which we'll get into here in just a minute, as well as the conversion of homocysteine into methionine, which we'll also talk about, again, very deep. And then it converts into a substance called SAMe, S-adenosylmethionine, also we'll talk about, and it lowers homocysteine, and it aids in red blood cell production. So deficiencies of folate are a common contributing factor in anemias of, we say non-iron deficiency anemias, because a lot of people think of anemia and they think iron deficiency, but folate deficiency can cause different types of anemia, which we'll talk about. So these are key roles of folate. Now let's go through and we'll simplify these roles in context for you as it relates to symptoms, as it relates to disease, because that's important as far as I'm concerned for you to be able to take this home and understand it. So folate deficiency is linked with several types of health conditions, one being infertility. So ladies, if you have had a hard time with fertility and it's not your husband, maybe you've both been tested and his sperm are fine and his morphology of his sperm and strength of his sperm are okay, and you're still not capable of conceiving, infertility is linked to folate deficiency, largely because its role in DNA production and repair. It also plays an important role in fertility in estrogen metabolism, which we'll talk about shortly. But folate, very, very important. So if you are struggling with fertility issues, you might ask your doctor to measure your folate levels and determine whether or not that's playing a role. Folate deficiency can also contribute to different types of cancer. We've seen linkages to breast cancer and to colon cancer, to name a few, as well as heart disease. Earlier I was talking about a chemical called homocysteine, and this homocysteine causes vascular damage. If we look at what homocysteine does to the blood vessels itself, and this is actually an important conversation in context with people and doctors recommending statin drugs because commonly, in my opinion, the misconception that heart disease is largely linked to cholesterol problems is construed and really not very accurate. But this is what we're doing here is we're just drawing an image. This is a blood vessel. And so imagine blood flowing in this direction. And so what a lot of times will happen is a person will develop a plaque on the interior aspect of the wall of that blood vessel. So that plaque will build up and then create blood turbulence and disruption. And so if that plaque is dislodged, which it sometimes can, this plaque material will continue to flow down. And when this blood vessel branches off into smaller branches, you know, now you have the potential of a plaque like this creating a lodge and stopping blood flow to a tissue, leading to a cardiovascular pathology. How does this happen? Why does a plaque like this form? Predominantly, it's going to form not because of cholesterol. So the common myth is that cholesterol will cause this, and that because these plaques are made of cholesterol. Interestingly enough, now they're finding microplastics in these plaques as well, if you haven't seen that new research. But plaques form as a result of vascular damage. So imagine you have this inflammation that is occurring to the lining of the blood vessel. Okay, that vascular damage, and it's the damage that attracts cholesterol. If you didn't have the damage, the cholesterol wouldn't be attracted and you wouldn't form the plaque. So the question is, what causes the damage? Well, one of the things that causes this damage is a chemical called homocysteine. So when we're talking about the relationship of folate deficiency to heart disease and to cardiovascular complications, this is where it comes in. Homocysteine, it builds up in the bloodstream, and part of the way we get rid of homocysteine or metabolize homocysteine is through folate. Now, we also know pregnancy complications can arise as a result of folate deficiency as well. And, you know, similar to the infertility issue, part of it has to do with the ability to produce DNA and to make proteins. We know that birth defects, specifically what are called NTD, that stands for neural tube defects. So if you've ever heard of spina bifida, this is a type, or one of the main types, of a neural tube defect. We also see things like cleft palate and tongue ties can be problematic in some cases, but these are the main two: cleft palate and spina bifida, as a birth defect caused by folate deficiency. As a matter of fact, this is one of the reasons why folate was originally being researched. They were trying to figure out how these issues were caused, and some really great scientists identified folate deficit as one of the triggers. We know that malabsorption of folate is problematic in inflammatory bowel diseases like celiac, Crohn's, and ulcerative colitis, and there's kind of a link between the inflammation in the gut contributing to damage to the gut, leading to malabsorption of folates. And then once the malabsorption kicks in, the folate deficiency caused by the gut damage can make it hard to repair from the inflammatory bowel. Remember, your gut turns over, your gut cells. So if we just kind of, let's change our colors here. So if this is the stomach and the esophagus and the small intestine, and then further down the large intestine, the lining, the coating, if you will, that lines the cells that line the tissues of the small intestine, large intestine, stomach, esophagus, etc., these cells have a very rapid turnover, meaning they are constantly having to replicate new cells in order to maintain the integrity of the GI tract. So these cells, every 2 to 7 days, are new. This lining is new. And one of the reasons why that's important to understand is what we were talking about earlier, is that with inflammatory bowel disease, is this damage happening to the intestinal lining. Once you become folate deficient and you lack folate to help with this cell turnover, remember, this requires DNA production. And so now these cells can't replace themselves when they become damaged, or at least it's not an all or none. It's their ability to replace themselves is diminished. And so now the gut can start to break down. And so again, if you've already got inflammatory bowel disease and now you're folate deficient, this is why this problem can occur and why it can become even more exacerbated if this cycle is there. So very important, if you have inflammatory bowel disease, to recognize you're at risk for folate deficiency, and that very folate deficiency might also exacerbate your inflammatory disease. And this is also true because many people with inflammatory bowel disease take medications that can actually deplete folate. So again, the kind of irony there is the treatment for the illness reflects a deficit that can make the illness worse over time. And then we also have something called organic brain syndrome, which is also linked to folate deficiency. Now, if we get into the symptoms, how do we recognize it? So what are some of the early things that can show up in terms of this deficit? So some simple things to pay attention to. One is a swollen tongue. And we'll also see that the tongue not just be swollen or enlarged, but we'll see a magenta color. So that tongue will start to look more red and beefy almost. So folate can contribute to that, as can other B vitamins, but again, it's what we're looking for. It's very rare, by the way, that folate deficiency does not occur in a vacuum. It's usually present with other B vitamin deficiencies, especially vitamin B2, B6, and B12. Very common for these to manifest simultaneously and together. Cracks in the mouth, otherwise known as angular stomatitis, is where you get those deep fissures, cracks in the corners of the mouth. Mouth ulcers can be caused by folate deficiency. Early onset depression. So there's a lot to be said. We'll talk more about that in just a minute. Forgetfulness, it can cause brain fog, forgetfulness. Folate deficiency can cause diarrhea. We see this very commonly in people going through chemotherapy. One of the effects of chemo is an inhibition of folate, and so the GI tract will start to break down, leading to or trending toward diarrhea as a symptom. We know that folate also plays a role in nerve health, and so numbness or tingling, and this is typically in the hands and in the feet, where this can occur, what would sometimes be referred to as peripheral neuropathy. So again, folate can play a role in that as well. Poor memory is part of this here, kind of the correlation, brain fog, if you will, and confusion. It can get bad. Folate's linked also late-stage confusion, sometimes referred to as dementia. And then insomnia, or inability to sleep well, and so a huge impact on your sleep. So again, earlier warnings. Maybe you have some numbness or tingling in your hands. Maybe you are struggling with loose bowels and your memory's slipping. You can't remember where you put your keys. You're feeling depressed more frequently, and your mouth and your tongue are basically symptomatic and in pain, because this swelling can also lead to kind of a burning sensation. And you're like, why is this happening? Why are these types of things happening? Think folate. Now let's talk a little bit about some of the reasons why. So some of the functions of folate as it relates to why these things happen. Okay, so this first slide that we're going to pull up here is about folate and its ability to help you produce neurotransmitters. So if we look here, neurotransmitters. So the methylation, neurotransmitter, and antioxidant connections between folate and depression. So if you look here in this research study, our published paper, folate deficiency is also relatively common in depressed people, with approximately 1/3 of depressed individuals, that's 1/3, here, having an outright deficiency. Folate is a water-soluble B vitamin necessary for the proper biosynthesis of monoamine neurotransmitters. What does that mean? That means it helps you make serotonin, epinephrine, and norepinephrine, as well as dopamine. Now, think about it like this. A lot of doctors will use SSRI, which is a type of class of medication, drugs like Paxil or Prozac. These medicines, selective serotonin reuptake inhibitors, are used very commonly to treat depression. Now, part of the theory, although this has been debunked, but historically part of that theory was that the SSRIs preserved serotonin, and that was the mechanism of action of how they actually worked. Although that's been disproven, it is an important note to say that folate deficiency through serotonin can contribute to depression. And so if you look here in this diagram, what I'm trying to show you in this complicated looking diagram, if you see this right here, that's folate. It's a type of folate called 5-formyl tetrahydrofolate. But this pathway leads to the ability for a person to be able to produce serotonin. So if you don't have adequate folate, then it's very hard or more complex for your body to be able to convert tryptophan into serotonin. Remember, tryptophan is an amino acid derived from the consumption of protein, and it's a precursor to making serotonin, but to do this requires folate. And if you don't have adequate folate, your body loses its efficiency at serotonin production. We see the same thing can occur here for dopamine production. And again, dopamine is one of those hormones that makes us feel happy. It makes us feel satisfied or complete. And so if you have a lack of folate, your ability to make serotonin and dopamine is going to be diminished. A lot of doctors will use different classes of medications or antidepressants to try to treat this with this in mind as the mechanism of action. And what research has actually shown over time is that folate should be actually one of the things being used. Folate for actually the treatment of depression. There have been a number of studies showing this where folate was more effective or folate was extremely effective in the treatment of depression. Now in this study, this is a review published. You can see folate and its significance in depressive disorders and suicidality. And you see here mechanisms of homocysteine-induced neurotoxicity. This is what these authors of this research study are trying to basically illustrate. As I mentioned earlier, homocysteine causes vascular damage. I showed you a picture of a blood vessel, but homocysteine also causes nerve damage. And this is nerve damage both to general nerves, but also brain tissue. So we have homocysteine is neurotoxic. So it can damage nerves, it can damage the brain, and that's what this is trying to illustrate. As you've got here, you've got hyperhomocysteinemia. This is high levels of homocysteine in the blood, right, leading to several different things that can lead to neurotoxicity. So you've got, in one scenario, you've got what's called impaired methylation. The inability or the reduced ability to make DNA to produce myelin, which is the coating that surrounds your nerves, but also to produce the membrane phospholipids. These are the specialized types of fats that protect the cells. And then also to produce receptors, neurotransmitters, as I just showed you. And then we come to this middle here where you have a neuroexcitotoxicity. And then you have here on this side, you have hyperhomocysteine causing ROS, reactive oxygen species. So oxidative stress, this is when people refer to or use the word, if you've ever heard this term, free radicals, that's what this is in reference to. This oxidative stress is basically free radicals, which can damage nerves. And then you also have endothelial damage. Now, that's what I was showing you earlier with the blood vessel, right? So you had the blood vessel that had damage to the lining. That damage can impact blood flow, leading to reduced blood flow to the central nervous system, also referred to as hypoxia, or reduced blood flow, or really technically reduced oxygen. So it reduces the capacity to deliver oxygen to the brain, which can lead again to a neurotoxic reaction in the brain. So this is how high homocysteine caused by folate deficiency. So if we come back over here, low folate leads to elevated homocysteine, which can damage nerves, can damage brain tissue through multiple different mechanisms. And so, again, up here you can see folate deficiency here. There are also genetic factors. A lot of you are probably going to be asking about this MTHFR mutation. Individuals with severe MTHFR mutations are at greater risk for folate deficiency, especially if you're taking or using food products with folic acid in them. Now, if you have MTHFR mutation, that doesn't mean you need to take supplemental folate for the rest of your life every day. But what it does mean is if you're eating processed food products that contain this synthetic folic acid, remember we were talking about that earlier, what happens when you take folic acid, you have to convert it into methylfolate. Okay, and if you have an MTHFR mutation, you don't do that very well. So if you bombard yourself with the synthetic type of folic acid, you're going to have a buildup of synthetic folic acid, which can also contribute to, it's been linked to and suspected to contribute to different types of cancers and other problems with inflammation. So it's one of those things, if you have MTHFR, you absolutely want to make sure you're getting any kind of folic acid out of your diet. And if you're going to supplement, you want to use a methylated version of folate. So methylfolate would be a superior option. Methylfolate is what we find in real whole food. Again, real food, not processed food that have synthetic folic acid added to them. So keep that in mind. If you have a mutation, avoid folic acid. Now, a lot of you may be taking certain types of medications that interfere with folate. A classic example of that is, let me draw you another picture here. Let's make some room. If you have rheumatoid arthritis, RA, or other types of inflammatory arthritis, one of the common prescription drugs that gets put out is a drug called methotrexate. Now, methotrexate blocks folate, and so oftentimes the rheumatologist will put the patient who's taking methotrexate on synthetic folic acid in an attempt to overcome this drug-induced side effect. Again, it's very important if you're one of those individuals and you have this MTHFR mutation, folic acid's a bad idea for you. You're going to not want to do that. Talk to your doctor about testing your MTHFR mutation to see if you have it so that you know whether or not avoiding folic acid is the right idea, because there's plenty of supplemental folates. Again, that methylfolate would definitely be a better option for you supplementally. You would need to take it, because of that, if you were going to continue using that kind of medication, but you just need to be aware. So there are many drugs that interfere with folate. We'll talk more about that in just a moment. And then, of course, I mentioned earlier, there are diseases that cause or contribute to folate deficiency, predominantly celiac disease, inflammatory bowel disease like Crohn's and ulcerative colitis, gastritis are common reasons why a person might have predisposition to developing a folate deficiency. So, all that being said, that's part of the mechanism of how a folate deficit contributes to problems. Now, I want to show you, this is a recent meta-analysis that was done looking at a lot of folate studies. In this particular analyses, they looked at over 100 studies and meta-analysis of folate on disease. And so this was the conclusion that they came to here. Beneficial effects of folate were observed in the all-cause mortality rate and in a number of chronic diseases, including severe birth and pregnancy outcomes, several cancers, cardiovascular disease, as well as metabolic-related outcomes and neurological conditions. Current evidence allows for the conclusion that folate is associated with decreased risk of all-cause mortality and a wide range of chronic disease. So again, very important vitamin. You don't want to be deficient in folate for any length of time for a number of reasons. Those were listed there, were pretty clear. Okay, so additional symptoms of folate deficiency, we've got fatigue, and this is largely because of what we spoke about earlier, and I'll define this a little bit better for you here in just a minute. But anemia, right? Anemias lead to fatigue. They also lead to headaches. They can also cause muscle weakness and muscle pain. Anemias can also cause heart palpitations. We also know folate deficiency associated with weight loss. This has to do with damage to your GI tract. Remember, as I said earlier, you need folate to properly upregulate or maintain the health of the cells of the GI tract. We get the same thing with loss of appetite and dizziness. This is another one associated with, with anemia as well as shortness of breath. So a lot of these are linked back to folate-induced anemia. And so let's kind of spell that out so you can see the mechanism there and understand it a little bit better. So in this study, this was a diagram. This is published in Antioxidants and Redox Signaling, Red Blood Cell Function and Dysfunction, Redox Regulation, Nitric Oxide Metabolism, and Anemia. So what I'm really trying to show you here is in this bone, you have a process called erythropoiesis whereby you're making new red blood cells. So reticulocytes are basically young red blood cells. They're blood cells being produced and they're not quite matured, right? You can see, so that when the red blood cells are born, they're called reticulocytes, and then they go through this process of maturation. Now, this process of maturation, one of the major requirements for it is folate. And if you are folate deficient, you will not see your red blood cells mature properly. You will also see a reduction of the ability to make these reticulocytes, because that's also part of what folate plays, where folate plays a role in red blood cell production. So you get a reduction of maturation. You also get a reduction of maturity and cell replication. And so what happens is you get these very, very large types of cells. Notice how, as this process of maturation goes on, look how large that cell is, and look how large that cell is. But as we go through the cycle, look, they get smaller and smaller. And so a mature red blood cell is small. Generally, this doesn't actually reflect what they look like 100%, but they're little biconcave discs. Let me start that over, Mel. They're little biconcave discs that have hemoglobin protein in them, and this is how they carry oxygen. That oxygen binds to the concavity in that red blood cell. So again, if we're trying to understand the nature of this, these mature red blood cells are smaller. These large red blood cells are not quite mature, and so when we have an immature red blood cell, what's going to happen on your blood work, on your regular lab work, is you're going to have an elevation in something called MCV, mean corpuscular volume. So when you go to your doctor and you get your physicals and your blood work drawn, this is a very common marker found on a blood count, or on what's called a CBC, a complete blood count test. Well, MCV typically is represented as one of the markers on that test, and what an MCV is it's measuring the size of the red blood cell. And so if you have a large red blood cell, the MCV will be high, indicating you're stuck here. And this is what's oftentimes referred to as macrocytic anemia or megaloblastic anemia. So you've got, again, a red blood cell that's not maturing fully because of folate deficiency. Now it's not just folate deficiency. Vitamin B12 deficiency can also do that, and so it's important to understand that folate and B12 generally should be taken together. If you're going to take high doses of B12, you should also consider that you're also getting folate in supplementally, and vice versa. If you're taking high doses of folate, you'd want to consider more vitamin B12. They work in tandem and they work together to help with a lot of these different functions, and so you don't want to, one of the byproducts that can happen is if you're taking high levels of folate for nerve pain, for example, if you have the neuropathy that we were talking about earlier and you're taking folate because you think that's going to fix it, well, high doses of folate will mask a vitamin B12 deficiency. And this is why it's always important to just look at them and take them together so you don't run into this type of problem. Now, that's if you're supplementing on your own. If you're visiting your doctor, it's important that you have these things measured. Have your levels measured. And, most of the time they're going to do what's called a serum analysis, where they're going to look at the serum quantities of your B12 and folate. Serum testing is a little misleading. It's not always super accurate. You get a lot of false negative in that regard. So it's better to look at this from the perspective of intracellular functionality. So measuring intracellularly, so running at what's called an INA, an intracellular nutrition analysis, where you can look at these nutrients to see whether or not you are deficient in them. So again, keep that in mind. Now, moving on to medicines that can deplete folate. I mentioned methotrexate earlier for those of you that are diagnosed with diseases like RA or reactive arthritis. Those block folate. And you also have metformin, which is the drug that is commonly used in diabetics for insulin sensitivity. Metformin inhibits folate, but also inhibits vitamin B12 as well as CoQ10. So important to understand that, because the deficiency of these nutrients contributes to an increased risk of heart disease and vascular inflammation. And so if you're on this drug for any great length of time and you start developing neuropathy is commonly blamed on diabetes, right? We've all heard diabetic neuropathy as a potential side effect of being diabetic, but I've seen it more that it's not the diabetes causing the neuropathy so much as it is the treatment for the diabetes causing the deficiencies of the nutrients that regulate the health of the nerve, and so you end up with these neuropathies as a result of drug-induced nutritional deficiency. So keep that in mind if you're on metformin. Again, you should have your doctor measuring these things on a regular basis. Now, if you're popping aspirin or other NSAIDs, like ibuprofen, etc., know that these can also contribute to folate deficit, as well as vitamin C, as well as iron deficiencies. So again, and I'm not talking about the single use, like maybe you took some because you had a joint pain one day and you just needed a little bit to take the edge off a little bit. I'm talking about those of you who are chronically taking it daily. Who takes it daily? Typically, people where their cardiologists want their blood thinner because they've had either a risk of stroke or heart attack, and so the cardiologist says, take that baby aspirin every day, right? That baby aspirin is blocking folate, vitamin C, and iron. Deficiency of these nutrients increases the risk for heart disease. Again, it's another classic scenario where the very drug designed to treat the potential risk for the disease leads to nutritional deficiency that increases the risk for the same disease the drug is trying to reduce the risk for. You're never going to win in that situation. So you have to know these things, because I can promise you the likelihood that your cardiologist or your endocrinologist or GP is going to understand drug-induced nutritional deficiencies is close to 0%. Those doctors don't get trained in drug-induced nutritional deficiencies, so it's not something I would hold them accountable to. It's just not something they research. So you also have antibiotics. Now, how many of you have used antibiotics repetitively over the course of your life? Antibiotics can contribute to folate deficiency as well, so be aware of that. You also have diuretics, another drug used to commonly treat hypertension or high blood pressure, can contribute to folate deficiency. As I showed you earlier, folate deficiency can contribute to heart disease. So why are we taking a diuretic? To reduce the risk of heart disease through blood pressure. Alcohol. Now, a lot of you don't consider alcohol a drug, but it very much is a drug. And alcohol depletes folate because when you drink alcohol, you need more folate to properly metabolize that alcohol. The same thing we see with high caffeine. Caffeine is a type of diuretic. So I'm not talking about those of you drink a cup of tea or a cup of coffee a day and kind of keep it within reason. I'm talking about those of you that drink the pitcher of coffee every day to keep your energy up, or those of you out there swilling down energy drinks with, 300, 400, 500 milligrams plus of caffeine a day. This is where you're going to get into a lot of trouble with nutritional depletion. So be aware of that. Okay. Let's look at a couple of other things here. I think it's important to understand a little bit more context around some of these nutrients as well. I just showed you a bunch of medicines that can deplete folate, among other nutrients, but I want to show you as well where folate works. So, one of the things that folate touches so many different chemical pathways in the body, and that's why it can lead to so many different risks and problems. So this publication, although the article is about diabetic retinopathy, so basically damage to the eye, and one of the side effects of diabetes over a long enough period of time is blindness through retinopathy. But what these authors of this paper did a really good job of was demonstrating the nutrients around the folate cycle. And so what we're looking at here, I told you earlier that folate is necessary to metabolize this chemical compound called homocysteine. It actually converts homocysteine into methionine, and then methionine helps to form a substance called SAMe, which is very, very important. SAMe plays a major role here in, this is the kind of the end stage where we're getting DNA, RNA, phospholipids, and proteins being produced. So again, this pathway becomes very important for a lot of different reasons. But again, we get rid of a toxic compound and we end up with a compound that can help to make new DNA, RNA, and cell membrane components. We can also get rid of homocysteine through, so this way is generated by folate. So this pathway is folate dependent. Now you also need vitamin B12. Remember I told you they work together in a lot of different ways. This is one of the ways where vitamin B12 plays a critical role as well, along with folate. But you can also get rid of homocysteine with vitamin B6. So this is where other vitamins play a role in this pathway as well. So vitamin B6 can actually convert homocysteine downstream into cysteine, which is important and necessary for taurine and bile salts. So those of you with bile problems, if you have had gallbladder issues, commonly it's a common thing for doctors to remove someone's gallbladder, but taurine deficiency, and again, part of this you need B6, taurine deficiency can contribute to poor gallbladder function. You've also got cysteine that can convert into sulfate as well. So again, we get rid of homocysteine through this pathway. We can also get rid of it through this pathway over here, which helps to make something called glutathione. Now, many of you have heard of glutathione as a very powerful antioxidant. It's absolutely necessary. So again, you can see the key mechanism of getting rid of this toxic compound can lead to so many other good things. And a lot of this is revolving around B vitamins. So folate being one of the main ones, but B12 and vitamin B6 are also important. But then you can also see in this study here, these authors are talking about how glutathione is important to protect the eye, but then you also have all these other nutrients that they're referring to as eye protective as well. So vitamin B3 and vitamin B2 and vitamin B1 and selenium, as well as vitamin C, E, alpha lipoic acid, zinc, copper, and lutein. So in this study, their design is just to show that elevations in homocysteine, which we don't want, remember that's that key chemical, is a bad thing because it leads to oxidative stress, and that oxidative stress can cause damage and potentiate diabetic retinopathy. So looking at optimal combination of nutrients to reduce homocysteine and support the reduction of oxidative stress was the target goal of the authors of this paper in helping you understand that. But that's one aspect, again, of folate. And then another aspect of folate is in its metabolism of estrogen and breast cancer risk. So if you look over here, central theme again, homocysteine. Homocysteine is critical in producing methionine, which then turns into SAMe, which this process right here, you see this box I'm drawing for you, that's catechol-methyltransferase. This is getting a little technical, but this is an enzyme that helps to properly metabolize estrogens. You see that term, methoxyestrogens, because what happens if we don't have adequate SAMe and we have poor COMT function is we get different kind of formation of different kinds of estrogens. And these estrogens have the potential to be genotoxic and increase the potential risk of certain types of cancers. So we really need folate, right, to get here. We need folate to get here to help us to properly metabolize estrogen. So again, just another important role of folate, ladies, as it relates to the potential for the development of breast cancer. Let's talk about how we can get folate in our diet. Some of the best food sources I've got listed here on the board for you. Hands down, liver, number one, best source. Spinach. Those of you that may be following a low oxalate diet may not be able to tolerate spinach very well, or beets for that matter, but some of these other things, romaine lettuce, cauliflower, squashes, and then we get over here to strawberries, bell peppers, Brussels sprouts, asparagus, tomatoes, avocado, broccoli, cabbage. Another food that's rather rich in folate, if you eat enough of it rather, is egg. Eggs are, very rarely does somebody eat one egg, but if you eat, 3-4 eggs, you get quite a bit of folate in that. It's upwards of 80 milligrams or 80 micrograms per 100 milligrams of eggs. So not a bad source overall. So should you supplement with folate? And the answer is it depends. Could you? Yes. Is it dangerous? No. There's no real long-term research or studies that show that supplementing with actual folate, and I'm not talking about synthetic folate, I'm talking about real methylfolate, are really no huge long-term risk concerns. There are a couple of minor observations around prostate, guys with prostate issues. So if you are one of those gentlemen, measure it. Measure your levels before you consider supplementing. But beyond that kind of generalized exception, there's really not a lot of danger in supplementing. My opinion of supplementation, though, regardless, is if you don't know whether or not you need it, there's no purpose or specific reason in doing high doses of folate just because. So it's always best to just get it measured. If you test, you don't have to guess. Again, the best way to measure it is through intracellular nutrition analysis. Now, if you're going to supplement with folate, you want to use 5-MTHF. This is actually a patented type of natural methylated folate. And so if you're looking at different options for supplements, folinic acid and folic acid are not good as supplements. So if you're looking at a product and it contains those ingredients, I don't recommend them. I do recommend 5-MTHF. Now, if we're looking at what is the adult kind of general recommendation for adults, it's 400 micrograms a day, although they've recently changed that to something called a DFE. That stands for dietary folate equivalents, but 400 micrograms a day is a pretty decent supplemental dose. As far as women are concerned, 800 to 1,000 micrograms, or again, DFE. Because of the risk during pregnancy of birth defects, the need for folate goes up. Why? Again, going back to what folate does, it's important in DNA and RNA. And if you're with child, there's a lot of this going on. And so get this so that you don't have this, and that's this dose. So that's the gist. Now, beyond that, you may have a number of the different types of symptoms or other disease processes that we spoke about earlier. And you may want to consider using folate as a supplement to support those things. But at the end of the day, remember, those symptoms that I showed you are not just unique to folate. And so you could have other nutritional deficiencies also contributing to symptoms just like what folate causes. So it's always best to test as opposed to guessing. But if you're going to guess, it's relatively safe to supplement between 400 and 800. So let's make room over here. 400 and 800 micrograms per day. Again, micrograms are DFE. They're labeling it now as DFE instead of micrograms, but dietary folate equivalents is what that stands for. So 400 to 800 is generally a pretty safe dose, and a lot of research shows that when people are between 400 and 800, actually 400 and 999, there's actually quite substantial potential benefit. So again, consider that if you're considering supplementing, but best bet is always ask your doctor to run appropriate testing to assess whether or not you need it, and this is especially true if you're taking any of those medications that we know can deplete folate. So that's a wrap on folate. I hope you enjoyed the show. Look, if you think this information will help someone else, hit that share button below, and as always, hit the like button or the thumbs up button, and make sure if you're not already, hit the subscribe button. We'll see you in the next episode. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.